Welcome to Mayo Clinic's ECG segment, Making Waves, continuing medical education podcast. Join us for a lively discussion on the latest and greatest in the field of electrocardiography. We'll discuss some of the exciting and innovative work happening at Mayo Clinic and beyond with the most brilliant minds in the space and provide valuable insights that can be directly applied to your practice. Welcome to Mayo Clinic's ECG segment, Making Waves. In this episode, we take a closer look at the intersection of radiation therapy and arrhythmia care. As cancer treatments continue to advance, so does our understanding of how therapies like radiation therapy can affect the heart, particularly its rhythm and the function of implanted cardiac devices. Joining us is a cardiac electrophysiologist with expertise in navigating these complex, multidisciplinary challenges. Our discussion will explore the effects of radiation on the heart, the arrhythmias that may arise, and how radiation can complicate the management of pacemakers and defibrillators. Let me introduce today's guest. Dr. Nicholas Tan, he's no stranger to this podcast. He's a cardiac electrophysiologist at Mayo Clinic in Rochester, Minnesota. Dr. Tan's journey began with a biomedical engineering degree from Johns Hopkins University. He then earned his medical degree and master's in biomedical investigation from the Cleveland Clinic Lerner College of Medicine. His training continued with residencies in internal medicine, his fellowship in cardiology and cardiac electrophysiology here at Mayo Clinic in Rochester, Minnesota. More recently, Dr. Tan completed a master's degree in medical device innovation from the University of Minnesota. He's now pushing the boundaries in heart rhythm treatment, cancer care in these patients, and we're so glad to have him back with us again. Dr. Tan, thanks so much for joining us.
Thank you for having me again.
You know, this is almost a continuation, and I'd really encourage those that have not heard your previous episodes to go and listen to them. But now looking at radiation therapy in this cancer population and how it affects the heart, how do you see it from more of an electrophysiologist standpoint when you come across these patients?
So radiation therapy is one of the cornerstones for cancer treatment, and it's particularly important for cancers that are typically implicated in the mediastinum in the chest. So when you think about breast cancer, lung cancer, the primary aim for radiation treatment is to target the tumor within these realms. And what radiation does is it causes ionizing damage, DNA strand breakage, and the induction of reactive oxygen species, and that leads to cancer cell death. Now, obviously, there are other things that live in the chest, and the heart is one of them. And so the heart can suffer collateral damage as a result. And this has been known probably since the 1950s or so, when they started studying survivors from the atomic bombings in Japan, and they realized that many of them started suffering cardiac comorbidities as a result. So radiation therapy can cause the heart valves to become stiffer and stenosed or narrowed. They can cause coronary artery disease to accelerate, and they can also cause arrhythmias to occur, either as a direct result of the radiation damage or secondary to some of these other hemodynamic effects from structural damage to the heart itself.
You know, you mentioned rhythm issues, and being a rhythm expert yourself, what are the types of arrhythmias that you come across, specifically radiation therapy? Do they differ from, other cancer treatments that we use, or are they kind of the run-of-the-mill rhythms that we're so used to?
So atrial fibrillation again is the most commonly implicated, and this is particularly well known in patients who have breast cancer and esophageal cancer. Now, for the latter, that's again it's quite intuitive. When you treat esophageal cancer, the esophagus sits directly behind the heart, and so and the part of the heart that's against the esophagus is the left atrium. So if the left atrium is exposed to radiation therapy, when you're trying to treat the esophageal cancer, that's how atrial arrhythmias can develop. And so these patients are particularly vulnerable to developing atrial fibrillation as a result. Now, radiation damage elsewhere in the cardiac chambers can cause corresponding effects. So if you irradiate the ventricles, you can have ventricular tachycardia. If you irradiate the conduction system, you're going to get heart block. So again, all of these effects are intuitive in the sense that if you expose the heart and the corresponding structures to radiation damage, then you can have arrhythmias that arise from there as a result.
We say run of the mill, but atrial fibrillation, very common, something that recurs. And, as you mentioned, the esophagus sitting right behind the left atrium with the pulmonary veins. And, many that aren't, may not have some of the mechanisms, and it's still not fully elucidated how atrial fibrillation comes about. But, some of them are the pulmonary veins have been implicated, and, the issues there. One thing for another discussion would be if our radiation therapy in the lab, makes a difference in it, or if it from the outside has any scars that affects. But I know it can complicate a lot of the management in devices and pacemakers, ICDs, defibrillators. What do you keep in mind when you're coming across these patients, and what should we keep in mind, when seeing them?
So if we think about it, pacemakers and defibrillators are fairly complex machines in their own right. They do wonderful things. They provide backup pacing. They help to prevent lethal arrhythmias. So there's a lot of complicated circuitry that is built into one of these devices. Now, these are actually very vulnerable to the ionizing damage from radiation therapy. And so this becomes important to consider when you have someone who is being treated um, or who's being planned for radiation therapy and they have a pre-existing device in place. Will that device be exposed to the radiation that you're planning to deliver to the chest? Is it in close proximity to it? And do we need to think about moving the device in order to avoid that ionizing damage that can result? The other implication that can occur is that if you have someone who has been treated with radiation, say as a child, over time, again, due to the acceleration in atherosclerosis and in vessel stenosis, that can actually complicate um, pacemaker or defibrillator implants. And I've had a few cases where the veins become so stenosed or so obstructed that it becomes near impossible to implant a pacemaker using a transvenous route. So that's where you have to think of alternative strategies to help support these patients again through their cancer survivorship journey.
Mm. And so it's really with these devices in mind, we have to be aware of, what kind of, how much radiation is being exposed in the location. It's a really complicated area, and I really thank you for being here. In today's episode, we explored this impact of radiation therapy, and certainly something that we don't talk a lot about. And we're glad that we have Dr. Tan here to help us understand what the electrophysiologic effects of radiation, the types of arrhythmias. We saw atrial fibrillation, that common one, the esophagus sitting there right behind or near the left atrium, and the unique challenges that clinicians face, what to keep in mind when cardiac devices come into play with radiation therapy. Dr. Tan, again, thank you for joining us. We keep having you back. We enjoy having you here. You're kind of our leader in this space, and so we look forward to having you back again soon.
Thank you very much. Appreciate it.
Thank you for joining us today. We invite you to share your thoughts and suggestions about the podcast at cveducation.mayo.edu. Be sure to subscribe to a Mayo Clinic Cardiovascular CME podcast on your favorite platform, and tune in every other week to explore today's most pressing electrocardiography topics with your colleagues at Mayo Clinic.
This has been a Mayo Clinic podcast.